Namaste and welcome to the next episode of Clinical Ayurved. Myself, Dr. Mayuresh Agte. We were discussing Dipan and Pachan Karma, and in that discussion, we have incorporated various principles which can be experienced or used in clinical way. In that manner, we have first discussed what is the importance of Tikta Rasa, then what is the importance of the Tikta Rasa as such in case of Sudarshan like Dravya, then how to balance the guna which are not required or which may hamper the chikitsa or increase the samprapti. So we have discussed other subjects also or other principles also on the background of Dipan and Pachan. Hope you have understood it, and we have discussed Tikta Rasa and Ampachan Karma and its all aspects in details. That too in totally clinical way. Now, by praising Tikta Rasa for so much episodes, the question remains, then what is the role of Katu Amla Lavana Ras as far as Dipan and Pachan Karma are concerned? So we will discuss this point in today's episode. Now in the beginning of Dipan and Pachan Karma, I have put two cases in front of you. First one that was of Jvara, and second one was of that Ajirna or indigestion. At that time, we have discussed that both are the cases of Agnimandya and Amotpatti. For example, a patient with Jvara, there is Tivra Agnimandya, Tivra Amotpatti, and complete Avradas, Siddhasodras. We have discussed it before. In second case, for example, someone takes heavy food continuously and then he complains of Adman, Udarashul, coated tongue, aruchi, etc., udgar. Now, when such patient comes to you, your diagnosis will be obvious that there is Agnimandya and there is Amotpatti, Udargaura, etc. Lakshana are there. Then, but it is not a case of Jvara. In Jvara and this patient, Agnimandya and Amotpatti are the common phenomenon, but what is the difference? That in Jvara there is extreme Amotpatti, extreme Agnimandya, and therefore Siddhavrod is up to the peak. Now in this case, where there is all Lakshana of Ama or Ajirana, there is Agnimandya, there is Amotpatti, but difference between Jvara and this patient is the intensity of Agnimandya is not that equal to Agnimandya in Jvara. Obviously, there is Amotpatti, but intensity of Amotpatti is not that equal to Jvara. Now, in this case, though there is Agnimandya and there is Amotpatti, intensity of both is very much less as compared to Jvara. In Jvara Chikitsa, we have discussed that Charak has stated Nadadhyatatra Bheshajam because Agni is so diminished that it has no power to digest the medicines also. Hence, in that case, Tiktaras comes at priority because it is Laghu for digestion and having Vayu Akash Mahabhut and Sandukshana is also been taken care of. In this case of Ajirana, there is Agnimandya, there is Amotpatti, but as intensity is not up to that level of Jvara, Agni is capable to digest the medicines you are giving. Agni, though there is Agnimandya, it is not up to that extent like Jvara, so Agni has the capacity to digest the medicines you are going to give, and in this case Katu Amla Lavan Ras come in the picture. As compared to Pitta Rasa, they are little bit heavy to digest, no doubt. But Agni in this case of Ajirna is capable to digest this rasa. Hence, in such cases, indication is Katu Amlo Lavan Ras than Pitta Ras, because these three rasa have Ushna Virya, have Agni Bhavut in that composition, so they will ignite Agni as well as they will be useful for Ampachan by Ushna Virya. Hence, in such cases, in practice also, we use combination of Katurasa or and Lavan Rasa together. The famous examples are Bhaskar Lavan Churna, Hingvashtak Churna, Shankhavati, like Kalpa, which we commonly use in such patients of Ajirna and having Agnimandya. So, Tiktaras is indicated, no doubt, when there is extreme Agnimandya and when there is no other medicines can be digested other than Tiktarasa. But when Agnimandya is not up to that level, we can definitely use or we use in practice the Kalpa like Hingvashta, Bhaskar Lavan, Shankhavati, etc. for digestion of Ama and Agni Dipan also. So, Katu Amla Lavan Ras are indicated for Dipan and Pachan Karma when intensity of Agni is up to that level that it can digest the medicines. In Tika, it is often used question in the orals specifically what is the difference between Dipan and Pachan. In the commentary of Charak, they have given a very good examples differentiating Dipan and Pachan Karma. Now, let us put the example what they have given. There is in the evening the cooking is going on in the house and suddenly the electricity goes off. Okay, so what is the normal course? We ignite a candle for the light. At the same time, the gas is going on cooking. Now, candle is also Agni, and the burner of the gas is also Agni. But that for the lighting of that room, the gas is not useful, and for cooking the food, the candle is not useful. Even though the both are the forms of the Agni only, and they are very close to each other. Now we have put that candle near the gas to see what is the cooking going on. So this example is given in the commentary. They have seen Deepanam iti prakashanam. It enlights just like candle which enlights the room. Deepan is the action and Pachan is for digestion. So by this example, you will be clear what is the difference between Dipan and Pachan. One is just Sandukshan and Pachan is for Ama Pachan specifically. Now, sometimes patient complain of there is no Ama Nirmiti and there is no any Lakshana of Udar Gaurav, etc. The tongue is also fine, so no Arushi Lakshana etc. is there, no coating of tongue. Still, the patient complains that I don't feel hungry. Initially, I used to eat 3 rotis and rice, but now after 2 rotis and some amount of rice, I feel fulfilled with the stomach. My hunger is relatively on the lower side. What is the diagnosis of this patient? Remember, he is hungry. He is eating 2 rotis instead of 3, but he is eating on his own will. There is no aruchi, there is no any amalakshan in that patient, but he is complaining that my regular food quantity is now on the lesser side. What is the diagnosis of this patient? We will discuss in the next episode. Thank you very much.